Okay, another example. This was health improvements, environmental health improvements. It was cleaning up areas that used to be industrial areas where, back in time, industry had been somewhat reckless about how they treated their waste products. So this was actually in a part of Sicily called Gela and Priolo, and they were to some extent ongoing industrial sites, but they had been historically what we call heavy industry, and these industries, things like chemicals, steel production, etc., these industries used to generate quite dangerous waste products, which back in time people didn't seem to care too much about and were a bit reckless in their disposal. And so a key issue here was one of attribution. If we look at these heavily polluted sites, it's quite clear that on the health indicators, there are many, many more health problems for local residents. So it's quite clear that those people who live in areas affected by the environmental pollution have poorer health. But what's not so clear is how much of their poorer health is attributable to the environmental pollution. Maybe the people who live in these areas are poorer than people who live in non-polluted areas. And maybe it's their poverty that causes the poorer health and not the living in the polluted area, for example. So it's a question of attribution. Now again, we can't rewrite history. We can't sort of randomize people 20 years ago and randomly allocate some of these poor people to live in the polluted area, randomly allocate some of them to live in a less polluted area, and similarly for the less poor people, it can't be done. So it's the problem of, predominantly a problem of randomization, or that we can't do anything about randomization. And so the issue then is how much of the poor health, and it's definitely the case, there's good evidence that health is poorer in these areas, how much of that poor health is attributable to the industrial pollution. Another problem is if you do clean up the site, how long will it be before we start seeing improvements in health? Because for the first few years, no matter how clean the site is, you're going to be living with the legacy, the historical legacy, the ill health because of what happened before. And so how long will it be, sometimes called a cessation lag, how long before we'll start seeing health benefits? How long do people have to live in the cleaner environment for a health benefit to start showing through? How rapidly will some maximum annual benefit be achieved? So what's quite likely is initially there's no benefit for a few years, and then the benefits begin to build up over time. And at some point they'll reach a maximum. And then how long do they stay at the maximum? How long before they start declining? How long will the intervention produce benefits? Now this raises an issue I haven't mentioned, but does come into economic evaluation quite widely, and that's something called discounting. Discounting. Now as individuals and as a society, we do behave as if we value benefits in the near future much more highly than benefits in the distant future. We do this as individuals, we certainly also do it as a society. We want the good things now, we don't want to wait for them. If we have to wait for them, the longer we wait, the lower value we attach to those future benefits. And just the same with costs, but it's in reverse. What we'd rather do as individuals, it appears, is delay the cost. Rather than pay the cost now, if we could pay the cost in 10 years' time, that's more attractive. Now, in the jargon of economics, that's called having a positive discount rate. Now, in economic evaluation, we formalise this. We recognise that there is this preference for benefits in the near future over further future, preference for costs further future over current or near costs. And we formalise it with a discount rate. So we calculate the costs and effects, costs and benefits of an intervention, and then we look at the timing of the costs, the timing of the benefit, and we multiply them by a discount factor. Now, I don't want to get into the technical aspect of it. Suffice to say, while that seems a good idea, what rate should you discount at? So if you discount at too high a rate, you're going to distort the relative costs and benefits or costs and effects. But if you discount at too low a rate, you're also going to introduce a bias. So it's an additional complication. Now this issue of discounting is also an issue in any economic evaluation of any health technology. So we're looking at a new drug, for example, the same issues can arise. Typically we incur the costs now, but the benefits may be in the more distant future. And the question is, how do we make the stream of costs comparable to the stream of benefits when they've got different timing? And so choice of discount rate is important. I'm conscious I seem to be doing all the talking this morning. Is this a Friday phenomenon?
I mean, there are no benefits. Some outcomes are always complicated, and if there are no benefits, then how will we?
Well, if there are no benefits, it's a lot easier, because then if it's only costs and there's no benefits, why would you want to do it? So if there's really no benefits, life is easier. Well, it's not better, it's just easier, because we know the answer. If we're going to have costs but no benefit, why do it? But if there are benefits, but they are in the further future, we tend to look at them as less valuable, and the further away they are. Now, as a group, you will probably have quite a low discount rate or low rate of time preference, because what characterizes all of you is a willingness to invest in yourself. Because you're involved in the university system, you have invested a huge amount of time and money, but time, in developing yourself. Now, the people who aren't here, that's a very large number, but the people who don't go to university, they don't study extra years, the people who leave, say, school whenever they can, they'll typically have a higher discount rate, because one factor that's affecting their behavior is they're not willing to wait for the benefits of being better trained, better educated. They would rather get out now and work now and get those benefits. Now, I do realize there's other reasons why you spend a lot of time in education. Parental influence, for example, or whatever reason. But one factor is your ability to give up And to incur costs now, that is not working in the labour market, spend time studying, be poorer now in order to be wealthier in the future. Now, it may not be that that's how you've looked at your decision, but from an economic perspective, it's arguably what's been going on. And so that's why I imagine you as a group have a relatively low discount rate. A low discount rate means you still attach a high weight to the future. If you've got a high discount rate, that's equivalent to attaching a low weight to the future. Anyway, I'll leave discounting just now. Of all the subjects economists ever talk about, discounting is the one that I've almost always found students have the most difficulty with. Okay, so that's an environmental health improvement one. I think this might be the last. No, it's not. It's not the last example. I've got some smoking cessation ones coming. This is a recent one that I've involved with colleagues looking at, and this is looking at indoor air pollution in primary schools. Now, when I first came across it as a topic, I thought, indoor air pollution in primary... I was very naive. I somehow thought, well, we're inside, the pollution's outside, we're inside, what's the problem? And then as you begin to learn a little bit about the topic, and it's a bit obvious when you think about it, indoor air pollution is very closely related to outdoor air pollution. Of course, there can be some additional sources. If we had a wood-burning stove, for example, we would then have more indoor air pollution. And what this study was looking at was the impact, particularly of NO2, nitrous dioxide, I guess it is. Nitrous dioxide is not the only thing in the air which is bad for exacerbating children's asthma, but it's one of the main things in air that causes these problems. And so there was a large European study looking at this issue across many, many different schools in many, many different countries, and trying to establish what the relationship was between indoor levels of NO2, nitrous dioxide, and the number of asthma attacks or exacerbations that school children were experiencing. And so the main aim of this part of the study was to identify the benefit from reducing exposure to NO2. And in a way, this highlights one of the points I was trying to make earlier, and that is, in this area, there's possibly a greater role for monetary valuation. Because one way of doing this analysis, this economic evaluation, one approach would have been to try and translate everything into QALYs. And so you think, right, what is the effect of different levels of NO2 on number of asthma attacks? What is the consequence for QALYs, quality adjusted life years, of fewer asthma attacks? And you could do it that way. But that link is quite, that link between the asthma attack and the QALY impact is quite tricky one. Instead, what we opted to do was look at willingness to pay. And so we had a separate study to look at the willingness to pay to reduce the risk of experiencing an asthma attack or exacerbation. Because if we could establish the value to individuals of reducing the risk of exacerbations, we could combine that with the information on the relationship between NO2 levels and the rate of asthma attacks. this study was unusual. It went one step further. It asked children their willingness to pay to reduce the risk of asthma attacks, and it asked their parents. Now, we don't usually ask children, and it's quite challenging to do it, but we got answers that seemed fairly sensible. Indeed, the children's answers made a lot more sense than the parents' answers, the willingness to pay statements. The children gave really quite considered responses. The adults, by contrast, the answers they were giving to the willingness to pay questions, the sort of questions that I talked about on Wednesday afternoon. The adult answers were a bit more random, I think, but the children's seemed very sensible.